Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navipet, Pune. Today's video is specifically for patients with borderline low ovarian reserve. Now, whenever a patient doesn't conceive naturally, she consults us, and at that time we always make it a point to assess her ovarian reserve on the second or third day of her menstrual cycle. It is done by blood test which is known as AMH and sonography, which is a special sonography which is done during the periods to assess the antral follicles or the recruitable eggs which are present in the patient. If the AFC scan shows less than 7 eggs and if your AMH is less than 1.5, you are a low borderline ovarian reserve patient. Now in these kind of patient, irrespective of the age factor, how long can we wait? Is it good enough to try IUI cycles, or is it prudent to upgrade the technology to get the best type of test tube baby cycle is the answer we have to find out. Now, how long do we wait? Ideally, it should not be more than 3 to 6 months because you are already having a low borderline ovarian reserve, which means that eggs are lesser in number and they may decrease or vanish anytime. It is most commonly seen in elderly patients who are more than 35 years of age, in which generally as per increasing age every month the ovarian reserve is reduced very drastically. Apart from this, is IUI a good option? Now IUI is nothing but we are increasing the number of eggs and taking the husband's sperm, making the egg rupture artificially with the help of injectables and putting the capacitated well quality sperms in the mother's reproductive tract. IUI gives only 10 to 15% success rate per cycle in the best of the centers. So instead of wasting your eggs by doing IUI, because if you are not in that 10 to 15%, it amounts to wasting those precious eggs and thereby decreasing your ovarian reserve iatrogenically. Best option in borderline low ovarian reserve patient is to upgrade the technology, do the best possible ICSI with a frozen embryo transfer to get a very good success rate of around 50 to 60% per cycle. So if you are a patient with low ovarian reserve, do discuss all these options frankly with your IVF physician, but the best option would be to go ahead and do a test tube baby to get your own biological child in spite of a low ovarian reserve. Thank you.